And staying with the UK, and Britain is due to begin its rollout of the world's first coronavirus immunisations using the BioNTech-Pfizer vaccine today. It's being called V-Day in Britain, and it's hoped the vaccine will mark the beginning of the end in the war against the virus.
This is a moment the whole world's been waiting for. The UK is the first to roll out the BioNTech-Pfizer COVID-19 vaccine. It's a momentous moment for a population with the highest death toll in Europe and offers a window of hope for the future.
We've very, very sadly lost many residents of those care homes who've died from COVID. It's been a hugely challenging and difficult year, and all the time this promise and this hope of a vaccine has been there. So it's very exciting to have got to the point where it feels like that we might be able to make a really positive step forward with the help of the vaccine.
The UK Health Service is calling this the biggest immunisation programme in its history. First in line for the vaccine will be people over 80, as well as care home staff and frontline healthcare workers. But this rollout poses major logistical challenges. This vaccine needs to be stored at around -70 degrees Celsius and moved carefully, meaning in England it will at first only be administered from 50 specific hospital hubs.
For the majority of the public here, vaccinations at sites like this hospital are still a way off. But for authorities in the UK, the messaging surrounding the start of this rollout could not be more important. After all, approving the vaccine is one thing, actually encouraging people to take it is quite another.
As the first in the world to authorise the vaccine, the UK is dependent on public trust, and enthusiasm isn't universal.
The risk is what the long-term effects, but against it, I would take it, because the benefits outweigh the risks.
Seems a sensible thing to do, yeah, and it's the only way we're going to get out of the pandemic.
I think it's very, very fast how it's come out. But I trust it.
I ain't taking it. I've done my research and the vaccine, so basically it's like a chip.
Where have you researched your concerns? You said
YouTube and Facebook.
Uptake of the vaccine will be key to its success, and authorities are being advised to find creative ways to address public concern and tackle misinformation. There's some speculation the Queen may even reveal she's had the vaccine to boost confidence.
It is extremely important that these people get the vaccine. So we need to find a way how to communicate it to them and how to, in a way, isolate them from these damaging examples of misinformation that they're seeing on social media. And I think it is the role for the health providers, it is the role for the community leaders to actually go out there and try to explain to them that what they're seeing on social media is actually not always the truth.
The eyes of the world are on the UK this week, with governments keen to see not just how it tackles the logistical challenges, but how it sells this vaccine to a public being asked to keep pace with science.